So let me raise the big questions that we need answers to. Is it too early to press the panic button? Is low hospitalizations rate the big plus point, a sigh of relief? Is Omicron just a mild variant of COVID? Or will the numbers scaling up create a big concern, particularly if Omicron gets tied up with Delta as well? These are some of the questions I want to raise tonight. I'm joined by some of the country's top virologists and epidemiologists, infectious disease specialist. Dr. V. Ravi is virologist and also member of Karnataka's COVID task force. Dr. Subramaniam Swaminathan is director infectious diseases at Gleneagles Global Health City in Chennai. Dr. Sameer Dalwai is member of Maharashtra's COVID-19 pediatric task force. Appreciate all of you joining us. Dr. Subramaniam Swaminathan, let me come to you first because you've been tracking these numbers very closely. When you look at the numbers, it appears there is an exponential rise. Some are now predicting that within a month from now, we could have or even 16 to 20 lakh cases at a peak period of Omicron variant or of COVID variant certainly. But hospitalizations at the moment are very low. But if it scales up, then hospitalizations could rise. So should we be pressing the panic button or be reassured by the low level of hospitalization that exists at the moment? In Mumbai today, not a single ICU bed was required.
Okay, so remember, we are moving on an exponential curve, and therefore, it may not seem very close by, but when you're moving on an exponential rate, you're going to hit the peak even before you know of it. And I think you're being very generous when you say a month. I would say that the peak is going to happen much before the end of the month. And therefore, I think we should all be getting ready for huge numbers.
What is that peak? What according to you, given that Omicron is about 4 times more infectious than Delta, what is the peak that you expect? Delta was 4 lakh cases per day.
So let's look at what's happening in the US. They projected 5 million cases or half a million cases per day based on the UK numbers. We are about 4 times US size. So let's say about 2 million cases a day at a peak. That would be kind of a ballpark figure of the new infections, but it's all dependent on how aggressively we test. Remember, in the US, they've rolled out self-test cards for rapid antigen tests so that the diagnosis can be made much, much faster. So I think this time around, unless we start pivoting it and start using rapid antigen tests so that we can do field-level testing and field-level diagnosis and quick turnaround and all of this, we may underestimate the numbers. Nevertheless, I think the numbers are going to be significantly high. And the concern is going to be a proportion of numbers. Even if the absolute proportion is very small, in terms of a huge spike, I think the relative numbers will still be visible. Don't compare everything with the Delta because the Delta was a catastrophe. Nobody wants to see another catastrophe. But if you look at what South Africa has projected, the death with Omicron so far at least is 16% mortality as compared to peak of Delta. So it's about 1 in 6, still a huge number. I don't think we should drop our guard against this. The good news is, yes, a lot of the people who are falling sick are younger people and they are bouncing back fairly quickly. But that is not to say that it's without any kind of risk and it is completely something we can ignore. I think it is going to be a problem because it could break the back of the health infrastructure because of 2 reasons. One is the incredible numbers of people who will need some form of care, may not need inpatient care, but at least some form of care, including children. And finally, also remember that outbreaks in healthcare have become a major issue. I just read of 87 doctors have become infected, and this kind of outbreaks are happening everywhere. Healthcare callouts is going up, and therefore we are going to have a crunch in terms of healthcare workers being available.
Right.
And that's going to be a problem as well. So just because we have the beds and the oxygen and the ventilators, that doesn't mean everything is hunky-dory, because if we don't have the workers, I think we'll still have a problem.
So let me summarize what you said, Dr. Swaminathan. You said caseload will increase exponentially. It could go up to as much as 20 lakhs a day. However, you are reasonably confident that the number of critical patients will be much lower than Delta at any given time. But because of the high numbers, even if it's a fraction of them require ICU beds, ventilators, that will put pressure on the system. Am I right? Broadly, that's what you're saying at the moment, a 20 lakh peak. And possibly because of the fact that the numbers are so high, it could result in some pressure on the system. Dr. Ravi, you want to jump into that because as one of the country's top virologists, there is a view at the moment that Omicron is mild because it is not affecting the lungs. Is that reason enough to believe that Omicron therefore will have mild symptoms for all? Or will those with comorbidities continue to suffer? Those above a certain age group could also suffer.
Thank you, Rajdeep, for having me on the show. I entirely echo what my very dear friend Dr. Subramaniam said. I always tell that COVID, there is more to COVID than the virus. Let me explain. Whether it is spread or whether it is disease. Disease in COVID, severity and mortality is host reaction more than it is viral virulence. So as Dr. Subramaniam very rightly said, let us not be complacent. There will be a proportion of people who will mount an inappropriate response, and that will lead to flooding of the lungs, and they would require ICU care. And when the wave is going to be huge, which is what it is looking right now, then we cannot be complacent. We have to get our systems ready. And we should not make the mistakes we made in the second wave. And what were those? We should not allow hospitals to get flooded with mild cases. That's very, very important. We should have, for those who are anxious and infected, I think we should have large number of COVID care centers. We should triage much better. We should monitor people in case they are at home through telemonitoring to make sure they don't deteriorate. We all know in the second week people deteriorate. And those with comorbidities and elderly and those who are obese will have certain amount of severity in illness. We know all this. The best part is we are more equipped now in terms of oxygenated beds. Let us put our heads together, work in a coherent manner, then we should be able to manage the surge, I believe. But there is no room for complacency.
Sir, no room for... Can I though understand, while you're saying no room for complacency, I think everyone agrees no room for complacency. But when I look at the numbers and I'm looking at the number of ICU beds, Mumbai today tells me that they did not require a single ICU bed. So no one was required to be on a ventilator. So even those who are on hospital are mainly minor cases. Are you telling me that will dramatically change?
See, what we are seeing now is infection largely in vaccinated individuals.
Yes.
If you look at the figures, if you look at the analysis, those who are single or double vaccinated are the people who are going out, who are letting their guard down and getting infected.
Yes.
God forbid, if it moves to the segment that is not vaccinated, then you do not have this kind of protection. We should assume that the worst is yet to come. We should not be complacent. Very nice that Mumbai ICU beds are not occupied. Today it is 7,000 to 8,000 cases.
Yes.
The way things are going, Mumbai may hit 60 to 70,000 cases in a day.
Right.
These are some of the predictions. I would not say projections, but predictions. At that time, you cannot say beds are not occupied. So let us be very, very rational, professional, and do our work in a very systematic, coherent way.
Right.
We have learned many lessons in the second wave.
Okay, I'll come back to you for more, but Dr. Dalwai, I want to bring you in because one of the concerns is, of course, just now Dr. Ravi said unvaccinated. Now that unvaccinated includes a lot of children. The 5 to 14 age group in this country, population of around 24 crores, all of them not vaccinated today. 15 to 18 have begun to get vaccinated. Is there a sense as someone looking at the pediatric COVID task force that is a concern, that those who are unvaccinated at the moment are young, could this time be more susceptible?
Good evening, Mr. Sardesai. Pleasure to be on the show with you, and also good evening to my colleagues. Let me just share one good news to begin with. Today, in the state of Maharashtra, we've had more than 175,000 children in the 15 to 18 years age group, which has been vaccinated. About 88% of people in Maharashtra have received their first dose. 55% have received both the doses. Now, let me tell you again what I'm seeing as a pediatrician. Though I'm not a practicing pediatrician, I work as a developmental pediatrician.
Yes.
But I've got so many calls from friends and family asking about their children who got fever. Now, this is very different because this didn't happen in the first two waves, because we know that children didn't get infected. Now, perhaps because the adults have been vaccinated And also because now everybody is moving out, we are getting more children with high grade fever. Very close friends, family, everybody calling up drastically that my child has fever. My message is, two messages. One is most of these children had a kind of a get together on New Year's Eve. And then it found out the day later that one of those children last night or one of those people in the party last night has tested positive. And that is actually, this is what I'm seeing in so many families. The other message is, by and large, children have been safe in COVID. And Omicron, as my friends have said, Omicron itself is not a very serious variant because it affects the upper airways much more than the lower airways. So these children, the message to the parents is don't panic. What you need to do is make sure that the children are well looked after. For God's sake, don't send them to school or online classes. Let them rest. See that they eat well, they are fed well, they have plenty of water to drink. If they have fever, please give them paracetamol. And please get in touch with your pediatrician or family doctor. If not directly, at least on an online consultation.
Okay.
Monitor the fever, keep measuring the fever, and keep looking after their children, and that will be fine. By this time, I think if the one person in the house has got the infection, everybody else has. But for God's sake, don't give it to the entire building or the locality. So I would request, what is most important, you heard the two experts already talk about it. The numbers are going to be exponential, no doubt about it. Fortunately, so far in the last week, already we've seen the cases that we have about 550 or so in Maharashtra with Omicron. Fortunately, they are not behaving very badly. What still remains is the fear if there is a very large number of people and the facilities may fall short. The only message is stay at home as long as you can, and you don't need to. And for God's sake, cut down on the socialization.
It's interesting. Doctors telling me this. The fact is, whether it's in Maharashtra with sound and light shows that the Maharashtra government has been having, whether it's election rallies taking place at the moment across North India, whether it's parts of the country where we've had New Year parties, people don't seem to be listening to this message, sadly, including in government and in civil society. But Dr. Subramaniam, you said home care. And just now, Dr. Dalwai said stay at home. Even if I have a mild cough, there are those who are rushing to hospitals. This is what someone at Leelavati told me, that there are people who are saying, no, I want to get hospitalized. When you don't need to get hospitalized this time. Is there a sense that doctors also need to send that message? That look, don't come to hospital unless you've got something seriously wrong. For a mild cough, mild symptoms, even if you're above the age of 60, stay at home and have a 5-day cycle. South Africa's details suggest that it's just a 5 to 7 day cycle this time.
Especially if you're fully vaccinated. I would complete that statement that you made with that key caveat. Because if you're unvaccinated, obviously none of this makes sense.
Right.
See, the point is that whenever you have a new wave, a new variant coming through, there's going to be a lot of panic. And we had a alpha/delta last time, and the delta was hitting us first. So we had nobody to tell us how bad it will be, or we had no models to go by. Now, this again, the problem is it's moved so fast. We still are having evolving data coming from everywhere else, and therefore people are obviously understandably concerned about it, and the graphs that you see of how quickly it goes up obviously scares people. See, that's curious, isn't it? It scares people into seeking care, but it doesn't scare people into doing the right thing in terms of staying home, wearing a mask. And that's something I could never understand, and maybe somebody who's an expert in sociology can probably try and help me understand that. But anyway, the point is, I think given that the protection from the vaccine and previous COVID infection, especially Delta, is so high, I don't think there is a need for people to panic, and it's important for people to stay home. So what we have done in our center is basically we are having a large gateway in the emergency itself, where we triage them and then send them back home with home quarantine letters. I think this is where the state government also has to be a little more aggressive. Both the central and the state government has to be a little more aggressive in terms of being very generous in terms of home quarantine regulations, and not place roadblocks on it, because there's no way to stop the Omicron wave by trying mitigating it or trying to put them all in a hospital. That won't work. So I think we need to popularize the concept of home isolation at all levels.
But shouldn't hospitals also do that? Hospitals hospitals also need to recognize that, surely.
Absolutely. See, also that, hospitals are also a little wary simply because we don't know how much of a surge there's going to be. And therefore, we don't want what happened last time. With Delta, what happened was we had people who did not look so bad, who were sent home on home quarantine and then suddenly became sick.
Right.
That's the concern that a lot of people have. And I think it's important for us to tell people, not just the lay public, but also the medical fraternity, but this is a different beast, and that we have enough information on this to know that the risk is primarily for what we say, what we've always been saying. That is for those who are unvaccinated,
Right.
or those with significant medical conditions like cancer or poor immune system, things like that. Outside of that, there is no reason to panic at all.
The worry, of course, Dr. Ravi, is that we are still haunted by the second wave, not realizing that in 6 months, what has changed is that many more Indians are vaccinated, 145 crores and counting, at least single vaccinated. You've got a situation where we have at the moment many more oxygen beds, ICU beds than we had earlier. And importantly, the fact that by and large Omicron symptoms seem to be milder. However, is there a fear that this could be, as in the United States, Delta mixed with Omicron? There could be some remnants of Delta still around, and as the US has found, that can actually become potentially virulent. Is that a concern that you have, that our testing systems are not being able to keep up with the rise in caseload? So we don't know actually at the moment how many people have Omicron and how many have Delta.
Rajdeep, thank you for asking that very, very important question. I must tell you that testing and differentiating to a certain extent is very important, as you pointed out, between Delta and Omicron. I must also tell you that within the next few days, you will hear some very good news saying that there are going to be tests which can differentiate Omicron and Delta very reliably in RT-PCR systems. The news will come out very shortly, and these are RT-PCR tests, and they will obviate the need for genome sequencing. So there is some very interesting developments happening. You will come to know of it probably within the end of this week. So I want to give that hope and good news to you. I do agree with what Dr. Subramaniam said, that we need to have very clear guidelines to hospitals that triaging is a very important step. The people, before they rush into hospitals, you should have a very good triaging system and reassure people, especially double vaccinated without comorbidities, that there is no need for them to get into the hospital and block a bed, so that when the needy comes. In second wave, if you remember, some part of the beds were occupied by people who actually did not require a bed. Let's not repeat that mistake again. Over.
That's an important point you're making. I hope that message is going down. You do not need to go to a hospital unless you have serious symptoms. Dr. Dalwai, today schools have been closed in Mumbai till the 31st of January. Presumably that's a precautionary measure. There is night curfew in place. But apart from that, I don't sense people actually panicking. Is that good or bad? When people are going out there without masks early morning across Mumbai, Juhu Beach, people are there without masks in large gathering. Is there a sense that either the message is not going through to people or there are different rules for different folks?
So, Rajdeep, panicking can never be a good idea, and I'm sure you all agree with that. The matter here is people should realize at least the seriousness to the level which they can help contain the spread of this pandemic. We all know this is a very fast spreading virus variant. So we know it's going to spread very fast, and it is. So it's up to us to know that if I have symptoms, how do I prevent this infection from passing on to other people? Now, you can't stop that in your own house maybe, but there is self-discipline that we need to practice. I'm sure we are aware that even the assemblies at beaches and everywhere else has been curtailed. The schools, as a precautionary measure, have been stopped because there will be parents who will come out to drop their children and so on and so forth. I think the most important thing right now, I would say again, as a pediatrician, one is everybody, please understand that the most effective measure to prevent infection is wearing a mask, safe distancing and hygiene. And the second thing is, if you have symptoms, please take a couple of days off. Please stay at home, rest it through. Most of you will get through this without nothing more than probably a paracetamol and some home remedies. If there is a problem, if you are not vaccinated, you are above 60, I would definitely say you need to make sure you get good medical consultation.
Right.
But the rest of you, please take a couple of days off, try and work from home, stay at home with the kids. Let this thing tide over. Like somebody mentioned, the cycle is much lesser and things will be fine.
Okay.
Just this kind of citizen care or precaution, I would like to use that word, from behalf of the citizens will help us a great deal to prevent a sudden surge the way it seems right now.
One final word from you, Dr. Subramaniam. So far, the numbers have been high in Mumbai and Delhi. That's where the exponential rise is taking place. Kolkata is also witnessing a sharp rise in the last 48 hours. Do you believe this is similar to the pattern of Delta? It starts in the big cities and then spreads, or could it be very different this time?
No, I think this is going to happen to any communicable diseases, any disease that way, which is person to person, simply because it depends on density and the options to move fast. And since major metros have a lot of opportunities that way to move very fast, it is no surprise that that's where the real numbers start to pile up. But I think the difference is going to be between Delta and this, and that the lag that's going to be there is going to be far less. Remember, I was looking at the numbers.
No, when you say lag, you mean lag between infection and and hospitalization?
Speed. No, I'll explain that. In that, I always compare what's happening in Mumbai and Chennai. For the Wuhan variant, it was about 3 weeks behind. For the Delta variant, it was about 7 to 10 days behind. I would say for this, if we 2 to 3 days lag time, that would be really incredible. I think it's going to go up almost practically instantaneously. It's going to be a wink in time, so to speak. And look at what's happening everywhere else. The numbers, don't really lag that far given the speed of transmission. Therefore, I think, this distinction in terms of when one takes off and when the other takes off is going to be absolutely minuscule.
But it's also coming down equally fast, Dr. Subramaniam.
Absolutely. No, see, that's the good news of going up that fast, because it will go into free fall very, very quickly. The question is for us to be able to tide over that and get to the other side with as little trauma as possible.
Okay. I think the aim, as always with top doctors, is to try and reassure people, to give them information. And once again, our doctors have done that. I appreciate all of you joining us here. Let's, fingers crossed at the moment. Let's hope we can tide over this surge, this time with rationality and reason above all else. Thank you all very much for joining me here at the top of the news today.